Hello everyone, my name is Aisha Patel. I'm an associate professor in the Division of General Pediatrics here at Stanford. Today it is my pleasure to tell you about our work to strengthen school nutrition programs to address food insecurity for Latino immigrant population. At the beginning of the pandemic, Cultiva la Salud and Dolores Huerta Foundation, two social justice and health equity organizations working in California's San Joaquin Valley region, reached out to us at Stanford and our partners at the UC Nutrition Policy Institute. They were concerned that as schools closed to prevent COVID-19 transmission, students in the area wouldn't be able to access school meals. For some context, the San Joaquin Valley region pictured here is an area of California that is home to Latino immigrant farm-working families and has highest rates of food insecurity and associated chronic diseases in the state. As shown in this slide, while food insecurity was stable for the past 2 decades, it increased significantly with the high rates of unemployment during the pandemic. This was particularly true for households with young children. School meals play a critical role in addressing food insecurity and promoting health and academic performance for nearly 30 million children in the United States. During the pandemic, most schools continued to provide meals to students who were learning remotely via grab-and-go options, delivery of meals, and offering multiple days of meals at a time. Despite this, you can see that as compared to 2019 before the pandemic, participation dropped significantly in school districts in the San Joaquin Valley region after April 2020. This was also observed throughout the United States. Ashley Joel, a medical student at Stanford, worked with our team to conduct interviews with school district officials, community organizations, and parents of students in 6 San Joaquin Valley region districts to understand the barriers and facilitators of meal participation. Facilitators included flexibilities in programs that allowed schools to provide as many meals as possible to students and a program that provided funding for groceries for low-income families. Community organizations also rallied to provide critical supports. Despite this, parents noted barriers such as a lack of communication in Spanish about the meals, poor timing of meal distributions, meals that were repetitive, required preparation, were not culturally tailored, and not appealing. This work was published in Public Health Nutrition, and Ashley received several awards for her leadership of this study. As a next step, we work with parents on a photo voice project. Tatum Solberg, a Stanford pediatric resident, and Emma Higuchi, a master's student at Stanford, led this project. Parents took photographs of meals for a week and participated in focus groups to discuss what they liked and disliked about the meals. They are now using the photographs to advocate for changes in their local school districts. One goal of our community academic partnership was to ensure that the findings had maximal impact. We shared findings with local school districts and parents via webinars, through a Spanish language public radio program, in op-eds, and with advocates in support of legislation in California that would provide free meals to all students regardless of their income. We are happy to report that California recently became the first state in the United States to provide free meals to all students regardless of their income status. We are now focusing our work to partner with communities to develop strategies to increase participation in meal programs, particularly as they will be free moving forward here in our state. Our next step is to work with parents, school officials, our community partners, and a marketing expert at Stanford, Suchi Huang, to understand how we can improve communication about the benefits of school meals to increase participation to promote food security and child health equity. I'd like to acknowledge our many collaborators and partners, study participants, and funders for their contribution to this work. Thank you all for your attention.